This newscast has been brought to you by Jim Adler and Associates.
And welcome back to this Christmas edition of The Factor Uncensored. We're here at the Warwick on Westheimer in Houston. And of course, one of our favorites, Dr. Danish Ali from Arch Point Pain Institute is here. Merry Christmas, sir. And every year, just before Christmas, you leave the country and you go and give back like no other person that I know. Tell us about this trip that you make every year.
Yeah, Isaiah, Merry Christmas. Yeah, I've been doing this for the past 4 years, Isaiah. Every year around this time, around Christmas time, we go back to Pakistan, where we offer our medical services. I'm obviously a pain management doctor, and so I do a lot of injections to help folks. These are people who are 80, 90, 100 years old that are taking water from, on top of their head to miles down to their house from the wells. And so these are people who have been struggling for pain and with pain for a long period of time. And so what we do is we'll go in and offer injections, offer medications, all of these different services to folks in rural parts of the country where they don't even have primary care doctors, let alone pain management physicians.
And what is it like when you get there? Because I've seen some of the videos and some of the pictures. There are long lines of people all waiting to see you.
That's correct, Isaiah. It's very rewarding, obviously. It's a way that I feel connected to the country of Pakistan and to the people of that country as well. I'll tell you, what I see there is these people have been living with this pain. They've been living with these problems, medical issues for such a long time, and so they're just so grateful when we're able to give them that opportunity. And these are folks who now that I've been doing this so many years, they keep coming back. They keep asking, when's Dr. Ali coming back? When can we get that another injection done? So it's very rewarding. It's the best way I can put it, Isaiah.
Is it also heartbreaking that you are, for many of them, the only source of medical treatment and health care once a year? Obviously, you're doing what you can, but they can't afford it. It's not available,
right,
and they only do it when they see you.
That's the hardest part of what I do, right, is to be there and to see there's so much opportunity and so much need in that area, and I'm able to go for such a defined period of time. And so yes, that is something that I'm hoping for in the future can get more robust in terms of having more folks that can offer those services. And so rather than myself just being there and doing it, maybe having another colleague, another specialist that can come in maybe at 6 months down the road, maybe during summertime, and offer those services. So I'm hoping that we can get more people, and I'm hoping that we can help these folks because, again, like I said, they are really suffering and they've been living with this pain for such a long time.
And let's paint a picture for the viewer out there. When we take a look at the average income of someone in Pakistan, or the cost of, say, a COVID-19 shot, that would cost them like a week or a month's worth of wages.
Right, Isaiah. So, we talked about this initially during the pandemic. I mean, the vaccinations were so much that somebody would have to spend almost 2 to 3 weeks worth of their income for one person to get that vaccine. Now you multiply that by, 4 or 5 people in the household, and you've got, half a year of work or income that they've had to put for these vaccines. And so now it's gotten a little bit better. The vaccine, some places are now being offered for free. However, it is still difficult in these rural parts of the country for these folks to get these vaccines. And so my hope is that once I land, I can also talk to some of the health officials there, and we can try to distribute some of the vaccines in that area as well, because again, nobody goes there. Nobody talks about these rural areas in Pakistan, and they look at the bigger cities, they offer services there, but we miss this very vulnerable population of folks in those rural areas.
All right, Dr. Danish Ali, thank you for the work that you do, not only here in our community, but also there. And have a great time. Obviously, it's going to be a lot of work, but thank you for doing what you do, and we appreciate you. And Merry Christmas, for staying here with us on The Factor Uncensored. And we'll be back with more Factor Uncensored. We'll find a way for you to give back to the community. Stay with us.